Started. And a recording of this meeting will be shared out after the meeting, along with the slide decks and that are shared or presentations that are shared during the meeting and various flyers and updates and things that will be shared out. Okay. All right. Okay, so this is our agenda today. So we're going to start just with some quick August observances and some highlights. Then we're going to move into our presentations for today. So we're going to have an overview of the Breastfeeding Coalition of San Joaquin County, and then a WIC program overview, and then we'll open it up for some large group discussion Q&A, just time for questions and answers, and then we'll end our time today with some updates from you all. So any updates that you all have, any events that are going on, or resources you want to spotlight, or things you want to share, or successes, whatever it is, we always want to carve out time during our community links meetings for that. All right. Okay. So first thing I wanted to spotlight, we're getting ready to enter Farmers Market Week, and it's August 3rd through 9th. It happens every year, that first full week in August. And so I just wanted to spotlight a new market that we have in our community here in Stockton. And it started, I believe, June, this summer, but in June. And it's held weekly in the evenings, and it's in the parking lot of the Dameron Hospital. So especially if you're serving families that live in that area or near that area, it's a great resource, a way for us to get, fresh fruits and vegetables from local farmers into our kitchens and our diets. And so just wanted to spotlight that. It's also National Immunization Awareness Month. So, one really cool thing that I'm sure a lot of you are aware of, but Medi-Cal offers incentives in the form of gift cards to encourage clients individuals to participate in preventive health care like vaccinations and immunizations for kids and adults, as well as like other well child checkups and other types of visits like prenatal appointments and postpartum visits and so on. And so they can get gift cards ranging from $25 to $50. And more recently, Health Plan just adjusted their kind of like scale or the amounts that they offer to increase them in some instances. And so I encourage you to go to Health Plan of San Joaquin's site. Their program is called My Rewards. I'm hoping to have someone from Health Plan on soon to share more about this. But yeah, it's a really great resource. So National Immunization Awareness Month. Okay, August is also Breastfeeding Awareness Month, and which is our kind of inspiration for our topic focus for this month's community links. And we also have a couple weeks that are spotlighted during the month of August. One is World Breastfeeding Week, and that's held August 1st through 7th. And then is Black Breastfeeding Week, and that's always held the last week of August. Every August. So these are annual observances that happen during specific weeks during August. Okay. All right. And with that, my lead in to our first presenter today, Crystal Thornton. Is the new president of our Breastfeeding Coalition of San Joaquin County. And she is wonderful. And she's here to share a little bit more about the work that the coalition is doing and ways that we can connect and engage with that work. Crystal, are you in the room with us? If so, just feel free to unmute yourself.
I am. Good
Hey,
morning.
morning.
Thank you, Giovanna. Giovanna, if I can have you to pull up the Breastfeed SJC website. If you need the link, I can drop it into the chat. And we'll just go off of the website. I didn't create any slides or anything for this presentation. It's just giving you some information about who we are, where you can find more information about um, the coalition. Wait a minute, I'm gonna find the link for you. Or do you already have it?
I have it here, the Breastfeed SJC.
Yes.
Yep, let
You can
me just share
share.
screen.
Thank you.
Yep, okay. Let me know when it's,
I can see the screen. Can everyone else see the screen? Perfect.
Okay.
So thank you for having me. As Giovanna said, I am Crystal Thornton. I have been the new appointed president of Breastfeed SJC, which is the Breastfeeding Coalition of San Joaquin County. There are some members here on the line. There is a former president here on the line, and I'm so happy to see her face, because she definitely had laid some foundation and laid some ground for us. And in 2026, it will be our 30th year anniversary. And so I'll give some information about a conference that we have coming up. We have our annual conference typically between like spring and summer months. So I'll give information about that at the end. But right now, I just want to give some information about who we are. So we are made up of individuals in the community that enjoy lactation. So whether it be lactation education, you can be a lactation professional. When I became a member of the San Joaquin County Coalition, Breastfeeding Coalition, I was just a mom. Brand new mom. My son he's 13 now. So I've been in the world of lactation for a long time, at least a decade. I started off as a peer educator, and then I am hoping to sit for my board. So, an international board certified lactation consultant is what I aspire to be, or what I have been aspiring to be since I became a mother and learned all of this information. I'm hoping to sit for my springboard, so wish me luck. Um, but I was just a regular mom. So it doesn't have to be individuals that are working as professionals. It doesn't have to be pediatricians. It doesn't have to be nurses or OBs. You can just be a regular person in the community who is passionate about breastfeeding in our county or breastfeeding in general. There is no membership fee. So Giovanna, if you can scroll on the about. We'll get into it. So, our mission is to organize local efforts to improve the health of community by promoting, educating, and providing support for breastfeeding. And we provide a lot of that information in our monthly coalition meetings, which is every second Monday. It is hybrid from 10 a.m. to 12, excuse me. And if you keep scrolling, Giovanna. So if you click on the about, it'll give a little bit more information about our membership. Okay, there we go. So I gave our mission statement. Our membership, again, it's just the representatives in the community. There are a lot of WIC program or individuals who work for WIC. Again, we have some IBCLCs, we have peer educators, which is where I started. We have some lactation education specialists, and then other members in our coalition, again, are just very passionate about breastfeeding and the work in San Joaquin County and some surrounding areas. There is no membership fee. So all you have to do is on the website that where Giovanna just scrolled down to at the bottom, there is an information box where you can put your name, your email address, and I think a phone number. And then we go and we add you to our mailing list, and you'll get all the information about when our meetings are. There's constant updates, or those a number of updates when we have conferences that are coming up. There are save the dates on our website, and you'll get emails in regards to our coalition monthly meetings and the agenda on topics that we'll be speaking on. There's always education opportunities. There's a resource guide that we have curated over the course of the years. So there's been some changes and additions too. So we just revamped our resource guide, which is also on the website. So our objectives is to increase the number of physicians and other primary health cares and providers in San Joaquin County who include breastfeeding and lactation counseling and referral as a part of their care routine, which should be all medical centers. In accordance with the Healthy People 2030 National Health Promotion and Disease Prevention objectives, increase the proportion of infants who are breastfed exclusively through age 6 months, at least 6 months, and increase the proportion of infants who are breastfed to a year. Provide accurate, equitable, and consistent breastfeeding support, information, and resources to women, families, healthy professionals, and the community. We also aim to encourage breastfeeding friendly policies and procedures in all our area hospitals, birthing centers, local businesses, and workplaces. We also aim to educate local city and county government officials on the benefits of breastfeeding and involve them in making San Joaquin County baby friendly. And then, Giovanna, if you can go scroll down a little bit more, because this is the information for our coalition meetings. I'll also post a flyer and a link for you guys to grab. As well, Giovanna will post it as soon as she's done sharing this screen, but we are hybrid. So there is a team links that will be sent to you via email if you sign up for our monthly emails. You'll get the team links for the monthly meeting for if you want to join hybrid, which a lot of people do because we are hybrid right now, right? We're on a Zoom call and it's convenient. Or if you have the time and you can join us in person, we are at Healthline of San Joaquin in their community room. So that's in French Camp on Matthews Road. Again, 10 a.m. to 12 p.m. And then, Joanna, if you can scroll a little bit more. Again, this is our board. So I am the president. I'm a mother of three. I breastfed all of my children for at least a year or more. There's Wendy, who is our vice president. She also works for CMC WIC. There is Anna, who is our treasurer. She is Delta Healthcare's. I do also work for Delta Healthcare. She is Delta Healthcare's WIC program manager. Diamond, who is our secretary, who also works for Delta Healthcare Sister Coach program. Erica is one of the former presidents, but is now an advisor, and she is also a CLEC, a certified lactation education specialist. Olivia also works for WIC. She is the WIC coordinator, I believe, at CMC. And then Tamisha is the RBO. Oh, Wendy is also the RBO, which is the regional breastfeeding liaison for our area. And then also an IBCLC, which is an international board certified lactation consultant. She is also my manager at Delta Healthcare's Sister Coach program, which we've been in this space before sharing about Sister Coach, but this is probably the first time that we are sharing on behalf of Breastfeed SJC. So with that being said, oh, thank you. Yes, Wendy works for Public Health WIC, and then Olivia works for CMC WIC. Excuse me. There's a few different WIC agencies here in our county where mamas and families can receive benefits. As Giovanna pulls that up, she did highlight that it is World Breastfeeding Month. And so just to highlight some of the weeks that she had already mentioned, today is August 1st, so it is the start of World Breastfeeding Week, a global observance to promote breastfeeding. I thought I had the themes for this year pulled up, but I don't think I do. And then August 8th through 14th is Indigenous Milk Medicine Week. And that honors the communities of indigenous individuals. August 15th through 21st is Asian American, Native Hawaiian, and Pacific Islander Breastfeeding Week. And then Giovanna already mentioned Black Breastfeeding Week, which is August 25th through 31st. My new favorite, and I want to say it was just established last year or the year before, is Workplace Lactation Week. And that is because at the time when I became a mother, I was working at a local grocery store, which is probably where people were like, I remember her face from somewhere. I worked there for quite some time, and I was the only mama, who chose to pump at work. And so there was no space for me to pump at work. So I had to advocate for myself because I wasn't going to go and pump my baby's milk in a hot car or in a bathroom, or anywhere else where I knew that I deserved a private space. And so my manager at the time had to um, let me utilize her office until a space was created for me. And the space is still being used now to this day. But there was a little bit of a push. I had a female manager, and then she had an assistant who was a male, and we went back and forth about why I deserved this space, and it was a lot. So I'm happy that workplace is now being acknowledged. Um, and then there's also Latina Week, which I believe is in that same week. I believe workplace and Latina observance is they both share the same week, or they coincide that first week of September. And I believe those are all of the observances. There will be plenty of celebrations going on in our community and in our county. So be on the lookout. The first celebration that I am going to mention is with Delta Healthcare. And many of you probably have shown up. This is now, I believe, year 14. And I do work for Delta Healthcare, as I mentioned. So the breastfeeding celebration for Delta Healthcare is going to be tomorrow, Saturday, August 2nd. It is from 10 a.m. to 1 p.m. It's actually from 9:30 to 12:30. I don't think that was updated. But you can get there from 10 to 1. We'll probably still be circling around and having fun. There will be some knickknacks, plenty of water because, of course, we are in the high summer heats. Raffle prizes, plenty of other resources and exhibitors from throughout the community always show up. I'm not for sure if the milk bank is going to be there this year. I thought maybe there was some kind of maybe a different organization that might come out, but normally the milk bank comes out, and that's an opportunity for mamas who maybe have an overflow of supply, or maybe they have already weaned, their baby has weaned, or whatever the case may be, but they would like to donate their milk, which I have done plenty of times. So, including my own three children, I have provided breast milk for 10 total children. And that's through milk donation, milk sharing with family members. But it's a really great program, and I hope to see them out there tomorrow. So if you know any mamas who they have this oversupply or overabundance of frozen milk, please have them to come out. Any other mothers and families in the community that you feel like would benefit from showing up to this celebration, even if you just want to come out and show your face, get out and get some steps in before the sun comes really starts to beat down on us, please come out and celebrate with us. Um, and there will be a chocolate milk screening coming up for Black Breastfeeding Week. I don't have too much information on that, but I do know that there are just some events that will be happening surrounding National Breastfeeding Month. So this is just the one that I will start off with. And then we also will talk about all things breastfeeding and do a little bit more observation, observing for World Breastfeeding Month at our monthly coalition meeting, which will be the second Monday of this month, which I believe is the 11th. Let me double check my calendar. It's the Yes, 11th? Yes, that is the second Monday this month. Again, it is hybrid. So if you aren't able to join us in person, which we would love to feel your presence in person, but if not, we definitely enjoy seeing your faces on our Teams link. So it is every second Monday at 10 a.m. to 12 p.m. There is a QR code that you can scan. I know Giovanna is probably throwing all of the links into the chat for you guys to grab and go. But we will talk all things Breastfeeding Awareness Month at this month's coalition meeting, as we always do. Again, we provide education opportunities where you can go, and sometimes there's some CERPs provided for some of you who may need those, some nurses who may need recertification. And continued education serves. So we always make sure that we provide information with that. We always provide what's going on in our county, any updates from our county, and then we also get updates from the California Breastfeeding Coalition as well, as our one of our board members served as the chair with the CBC. And so we always give updates in our monthly meetings. And finally, I'm going to talk about our save the date for our annual breastfeeding conference. And so, as I mentioned, we are coming up on year 30 of the Breastfeeding Coalition of San Joaquin County. So in 2026, I believe March will officially make it 30 years. And then, so just a few weeks later, on Friday, April 3rd, will be our annual conference. For the past few years, I want to say at least 4 or 5 years, ETA has been held at the Ag Center. It's set up very beautifully. We have caterers that come out. It's very hands-on. We haven't yet secured speakers because we literally just secured this date like a week ago. And so I was like, let me put this together real quick in case anyone on the line they need something in advance because if you know anything about Giovanna and the work that she does, we need to know things at least a year in advance or at least 6 months in advance. And so I wanted to make sure to share this out with everyone on the call. It will be our 30-year anniversary, so we've got some big raffle prizes that we normally have raffle prizes every year, but there's going to be some big prizes, some big speakers, um, dynamic presentations, and reservations and observances at this particular conference because it is a big one for us. It is 30 years. So please save the date. There will be more information on our website. If any of you would like to be a part of the coalition, all you have to do is just show up. If you want to leave your name, number, email address in the chat or email breastfeedsjc.info@gmail.com. We will make sure to put you on the mailing list. And that is it. Thank you all for having me. Thank you, Giovanna, for inviting me. Thank you, Mary, for paving the way for me. I don't know if I'm doing you any justice, but I am doing my best. And thank you. Thank you so much for having me. Any questions?
Thank you so much, Crystal. I'm trying to see if I see any questions in the chat. So if they want to connect, I know that there's a form on this on the website, right? If they want to sign up to be a part of the coalition or get information about the coalition regularly, if they want to connect with you, is there a way to do that?
Me personally?
Yeah.
Absolutely.
Yeah.
You
Okay.
can, I can throw my email and information in the chat
Okay.
and you all can grab it. And or you can always email the breastfeedsjc.info@gmail.com.
Oh,
I'm
that's good. Just an email.
regularly in
Yeah, if
there.
there's
Mhm.
a direct email, that's good. If you want to drop that in the chat or email to me. So following up to our meeting, I always send kind of the wrap up with all the resources and flyers. I'll be sure to share out the links and the flyers that Crystal just shared. And that email, if you send me that email, Crystal, I'll include that in the follow-up
Yes,
as
ma'am.
well. Thank you so much. You're
Thank
already
you.
doing a wonderful job, Crystal.
Thank
I'm so
you.
excited you're in that position, just leading that work. It's wonderful. So, okay, we're going to transition to our next speaker. And Barrett, I'm going to give you a moment to kind of prep your slides. But Barrett Lee Shin is a public health nutritionist with San Joaquin County Public Health Services with the WIC program. And I've seen her present before, and her presentations are always they always stick with me because they're always so informative. So I was really excited that she was able to accept the invite to be with us here today. And with that, I'm going to hand it over to you, Barrett. I'm going to stop sharing.
Thank you very much for the kind introduction. Okay, and I was around before the Breastfeeding Coalition even started. So when you said it's 13 years, I'm like, okay. I'm so glad it started though. It's such an asset to our community. Okay, so sharing. So you see my screen?
Not yet.
Try to do this. I am not a techie person. My apologies to everybody. Okay.
We see it now.
Okay, great. Thank you.
Yay.
And again, pardon me, I'm not a techie person. Okay. I didn't grow up with computers like today. All right, so my name is Barrett Lee Shin. I'm a registered dietitian. I've been with the program for over 35 years, over 40 years with the WIC program. So I've seen it grow and I've seen a lot of moms being more breastfeeding is now a part of the program, which it didn't used to be way back when, and I am pleased. I'm a registered dietitian. If more women breastfed, it would put me out of a job, and that's my dream. So go for it. Okay, the women didn't go. Which screen do you see? You don't see the next screen. Okay. The Women, Infants, and Children program, again, as you all know, is a supplemental nutrition program, and it provides the supplemental foods, healthcare referrals, and nutrition education. Who qualifies for WIC? Any pregnant women, breastfeeding an infant, had a baby, or in the past 6 months, or even those women that have a pregnancy loss, they qualify for the program. Children up to 5 years of age, and those cared for a mom, dad, grandparent, foster parent, step parent, and guardian. Families with the low to medium income who receive Medi-Cal, CalWorks, or CalFresh, and they live in California. A lot of people are surprised that if dads are raising babies, they don't qualify, but they do. And we've had a few dads that are on the program, and they're wonderful parents, as well as all the step parents and foster parents. And they also must be at nutritional risk. All right, as far as eligibility is concerned, this is a gross monthly income, 185% of the federal poverty income, and it goes up every April. Okay, this year, for a family size of 4, they can make $59,000. If you have a family size of 8, you can make an annual income of over $100,000 and still qualify for our program.
Hey, Barrett,
Yes,
we have one question in the chat.
Sure.
Would you prefer that we wait till the end, or you want to
No,
take questions
I'm
along the
open
way?
to questions
Okay,
anytime.
great. So this question says, do they need to be a legal guardian if they are a grandparent?
If they're a grandparent and they're raising their child or their grandchild, I should say, and mom is not in the program, they can apply for the WIC program because they are the caretaker of the child.
Great, thank you.
But they must have the child in their care for the majority of the time. I'm sorry, my mouse is not working. Okay, I need to get a cat in here to figure out my mouse. Okay, again, their eligibility qualify if Medi-Cal, CalFresh, or CalWorks, and a pregnant woman and her infant has Medi-Cal, the whole family qualifies who meet the criteria. Okay, and sometimes that is a good thing that they qualify, but sometimes it's a shock because they need to be renewed. And if they qualify when they're an infant, they're eligible for WIC. When they do the renewal at 1 year of age, all of a sudden it might be like, why don't I qualify again? Because they don't have Medi-Cal after a year. So for some women, that is a shock. Okay, but they need to re-qualify basically every year. And a lot of parents are confused on that because they think once they get on the first time, they're on for 5. And they're like, oh, I need to re-qualify every year. So that's what the guidelines are. The services are nutrition education and health information, breastfeeding support, checks for healthy foods like fruits and vegetables, which we don't have checks anymore. It's all on the card. And referrals to medical providers and community services. We refer all the time to Head Start of San Joaquin, and First 5 and things like that.
Barrett, we have another eligibility question.
Sure.
So someone says, do they need to be a legal citizen?
No. No. We do not ask about citizenship at all. Anybody is welcome as long as they have an infant, they meet one of the categories, they are welcome. This is not a citizen-based program. So what we do is we do the prenatal nutrition, breastfeeding information, healthy eating tips for the family. We provide nutritious recipes, plus much more. And with that, we go to, for a lot of our educational recipe idea, we go to wichealth.org, and it has wonderful, wonderful recipes in there. I love that site. And unfortunately, I work for WIC, but I'm not on WIC, but I wish I could get those recipes off all the time. Because I've made a few at home and my husband just absolutely loves them. And then I can't make them again because I don't have the recipe. I was like, whoops. What the WIC team are, and this is for all the WIC programs in San Joaquin County, there's a registered dietitian or degreed nutritionist, international board certified lactation consultants, certified lactation educators, certified WIC nutrition assistants, and breastfeeding peer counselors. This is who the team is. They're required to have a nutritional assessment requirement, and that's done by trained staff to determine whether the individual is at nutrition risk. And this is done at no cost to the client, to the applicant. And also the information can be obtained from a health professional, such as a physician. Nutrition risk means that an individual has milk-based or dietary-based conditions. Examples are medical-based condition like anemia, underweight, history for pregnancy outcome. And a dietary condition includes, for example, a poor diet. And everybody has a poor diet within 24 hours. Nobody eats perfect. For example, I'll put myself on the block. This morning, I had a raisin bagel, a cup of coffee, and some yogurt. So if you all think about my plate guidelines, how could I have improved my breakfast meal? What do you think? Any suggestions? Fruit, exactly. Fruit and protein, exactly. Could have had a glass of juice, and if I had time, I would have had some protein in there, like a slice of ham. But I don't have time in the morning, so you know, I would have a poor diet today, and I'm a dietitian, so kind of difficult. At a minimum, the applicants, as I said, height and weight can be measured here at the office. We can use the Pronto device to do their blood work. And applicant has to have at least one medical or dietary condition on the list. So if I was eligible, I would be able to qualify if I met the category. But being 64 years old, I don't think I'm pregnant anymore. But I love babies. I love babies, so that's why I love this program. But WIC is not a medical program. A lot of people think WIC is a medical program, and it is not. If they need a medical formula, then we try to refer them to Medi-Cal to get the formula. For breastfeeding information and support, we do that in group or individual classes, one-on-one support with a peer counselor or lactation specialist, and a breast pump loans for qualifying moms. For prenatal, we do classes on baby cues, crying, sleeping, nutrition education for prenatal women, enrollment into the peer counselor program. And then for postpartum, we do again the class on understanding baby cues, because sometimes if we give it to them when they're prenatal, they forget all about it once baby is here. When it's like, uh-oh, real life comes in. So then we just review that over with them. We give nutritious foods and benefits for breastfeeding and non-breastfeeding women. We do peer counselor support from our nutrition assistants and peer counselors. And they can continue to receive benefits up to 6 months if non-breastfeeding and 1 year if breastfeeding. If they're non-breastfeeding, they can continue to, if they're mostly breastfeeding, meaning getting less than 4 cans of formula a month, they can continue to get food benefits. If there are 5 cans or more formula cans per month, after 6 months, they are still on the program, but they don't receive any benefits. So our goal is to keep those moms breastfeeding so they can continue to receive the WIC food benefits. And of course, we have the breast pump loans. Our peer counselor program is a good program. It's a one-on-one consultation with somebody who is breastfed and possibly were on WIC themselves. So it's a really, really, really good program. And we have a good program at our agency. And it is based on USDA's Love and Support model. The breast pump loan program, again, it's to enable WIC participants with special circumstances to initiate breastfeeding and increase duration of breastfeeding. The process is they're evaluated by a peer counselor or WIC nutrition assistant. The type of pump is determined as to what kind they need. Pumps are usually issued within 1 business day. Education is given on the pump, and contacts are made with the client. So to find out how they're doing and what further follow-up they need. And that can occur weekly or monthly. The WIC pumps that are available, they're hospital grade pumps. We give those out to moms that are babies under 2 months of age, exclusively breastfeeding moms, babies that are in the NICU, babies that have a medical issue, and moms struggling to breastfeed. This is an example of some of the pumps that we have, but we have additional pumps that are coming in. And that's a whole lot better than what it used to be. I remember the old suitcase type pumps, if you know what I'm talking about. The big old thing is like carrying around, it's like you're carrying around a big old suitcase. Like, what the heck is that? Okay. Like an Ardo pump is like, oh, you're just walking in with your lunch pail. No worries. So. Nutrition services, again, we give a nutrition assessment and education, personalized nutrition care plan and routine follow-ups, family-centered meal planning, and we really enforce the baby behavior education to help reduce the overfeeding and encourage exclusive breastfeeding. Our food product has been around, the WIC has been around since 1974. Okay, been around for 50 years. The food packages were originally designed for participants' diets. There were 5 target nutrients that were lacking. And those nutrients are calcium, iron, protein, vitamin C, and vitamin A. Those were the nutrients that were lacking. And the package now can provide additional, we encourage it because if they use the WIC program, they can save their food stamps for other items. The package is designed to encourage healthy eating patterns for today's lifestyle. We give milk, cheese, tofu, and yogurt. Okay, why do you think we give these foods? What are important in these foods? Why is that important? Go ahead and unmute if you want. Calcium, right? Huh?
I also said calcium, sorry.
Calcium, that's fine, Melissa, you're good. What other nutrient do you think the milk has? What other nutrient? I just mentioned a couple of them.
Protein.
Protein, cow's milk protein, right? Vitamin D, excellent. Vitamin D, and what other vitamin that was missing? Vitamin A, exactly. So that's why the calcium is on there, okay? For those nutrients that were lacking previously, okay? And we give the protein foods, okay? The beans or the peanut butter, the tuna and the eggs. Women, the only people that get tuna right now are exclusive breastfeeding women, but that will change in April next year. April next year, there will be a major food change coming down the pike, and at that point in time, all women will be getting tuna or 30 ounces of canned fish, but that's not till April next year. So why do we give the beans, the peanut butter, and the eggs? What nutrients are in those? What do you think?
Protein.
Protein, right. What else? There's another nutrient that people always miss. Why do we give those? Protein and what else? Fiber, yes, fiber is in the beans.
Iron.
Huh?
Iron.
Iron. Which ones have iron?
Beans, peanut butter, tuna.
Exactly. But the peanut butter does not have iron. Okay. A lot of people think it has iron. It is eggs. Eggs are high in iron. Okay. Peanut butter is high in protein and depends on if you get the crunchy, it might have some fiber to it because of the crunchy peanuts. But peanut butter is not historically known as iron, and a lot of people confuse that one. So I truly appreciate your answer on that one. Okay, and then we go for the whole grains. Okay, why are whole grains important for the body? Why are they important? I'm doing this as a learning education for y'all, ladies, not just to watch the shows, because if you watch it, that's not very interactive. So why do you think whole grains? Fiber, yes. To help the digestive system, yes. Our body needs fiber in its diet. Okay, if not, we end up having bowel movement problems. Okay, so
Barrett,
that's one of the reasons.
Barrett, we
Yes,
have one question
sure.
about the butter. So, do you give alternative butters for people with peanut allergies?
We do not. Not at this time. We do not. That is an excellent question, but that will be revised in April next year. Okay, when we get the new food packages in. But they did look at that, and that is an excellent question. And that's one of the reasons why the new food packages will be changing next year. Okay. The option is they don't have to buy peanut butter. They can buy the eggs or the lentils. Or excuse me, the beans or the lentils. If they don't want to buy the peanut butter. It's one or the other, one or the others. Okay, but that is an excellent question. So we have the whole fiber, we have whole wheat bread, brown rice that a lot of people are not aware of, brown pasta that not a lot of people use, but it's very simple to include it in your diet. Instead of buying the white pasta, just buy the brown spaghetti and you'll get it easily in your diet. And then of course the whole wheat bread, and you can get whole wheat hamburger buns as well that people are not aware of, but it needs to be 1 pound. We give the fruits and vegetables. Okay, this can be fresh, frozen, or canned. Most of the people here in California buy the fresh vegetables, and I'm so glad we have the farmers market now. And the new card that's coming out that can be used at the farmers market, not in San Joaquin County yet. It's currently being pilot tested in Stanislaus County, but that will be a change for next year. We're having juice that we still give, and I'm not one for providing juice because juice is really sweet, and a lot of people think if they get it from WIC, it's good, but juice is not the best thing. And of course, we give the mixed grain cereals, the baby cereals, and the baby infant fruits and vegetable jars. Breastfeeding babies do get baby meats. Now, as far as formula is concerned, we do give formula, and today is a major change in the formula. Our formula is contracted out. So every 4 to 5 years, the lowest bidder gets the contract. And we were previously on Similac products, and effective today, August 1st, we are going back to Infamil products. So this is the first day of the change. If they had Infamil or Similac previously and they were not reissued it, their new issuance will be an Infamil-based product. But I'm hoping people don't use the formula and they exclusively breastfeed because it's so much more healthier for babies, and you don't have problems with GI tract and all . I just really hope moms breastfeed more. And darn formula companies send all the flyers in the mail and get in your mailbox before you even had the baby. So it's subtle. I wish they would stop that. With the healthy food choices, again, are the fruits and vegetables, the whole grains. Low-fat dairy is for people that are age 1 and above. Excuse me, 2 and above. Soy milk is also another option. Tofu is an option for the calcium as well. We do not provide almond milk. We do not provide oat milk. We do not provide hemp milk. A lot of people think the almond milk is very healthy. Almond milk has got protein in it, and that's about it. The rest of it, almonds don't have calcium in it, and they're a lot really fortified. So I mean, if you look on the back of the label of the almond milk, you will see all the stuff that's added to it. So it's kind of people think it's so healthy, but you look at what you're drinking and you might want to reconsider. I've never seen an almond tree lactate yet. It's like, okay. And then of course I mentioned the formula and the iron foods. The education that we give is individually, as a group, or online. Online is by wichealth.org. And we really need to emphasize that good eating habits last a lifetime, and they're learned by the age of 5. So if you think back when you were a kid, some of your favorite foods are the ones you got really, really young in life. And that's how we learn. We do resources and referrals. We connect them to community services. We are the county's WIC program. There are other 2 programs here in San Joaquin County. But we've got a whole list of resources that we can just do a quick referral and they're in. Their food assistance and food banks, like emergency food banks, are referred to when needed. Substance abuse treatment, central intake is right next to where our office is. We're located on Railroad Square. We have substance, and we have, again, referred to Head Start. I was on the Head Start committee many, many, many years. The positive things that WIC Health come over the full 50 years that we've had is we've reduced premature births, and birth rate has been better. Reduce the low and very low birth weight babies, reduce fetal and infant deaths, reduce the incidence of iron deficiency anemia. We increase access to prenatal care. We bridge the nutrient gaps, increase the immunization rates, improve nutritional quality of the diet, and we increase access to quality health care. WIC is still funded through September 30th, and hopefully we will continue to get funding through Congress. Congress has been unilateral, bipartisan support for keeping the WIC program. So hopefully we'll still have the funds. Referrals make a difference to all the individuals we serve, and it creates savings in healthcare costs. So that's one of the benefits of the WIC program. These are where our locations are at. As I said, we're in the CalWorks building, aka Railroad Square, the old Sears building. We have an office in Manteca. It's open 5 days a week. We have an office at a French Camp, San Joaquin General Hospital, 2 days a week. We have a transcultural clinic over in Pershing, and that's open 1 day a week. And then we have an office on Fair Street at the Cuff Resource Center, Dorothy Jones Cuff Resource Center, and that's open 1 day a week. And this is the website for WIC, myfamily.wic.ca.gov is an excellent website. Explains all about the program. And they're the resources that I provided to y'all. And I wish you very much a happy Friday, happy World Breastfeeding Week, happy World Breastfeeding Month. And I appreciate your time. And if there's any questions, please feel free to reach out to me. My office, I didn't put a phone number in there, but my direct line number is 209-468-0374. So that is my direct line number. So if you need any questions or have any concerns, please feel free to reach out to me. And if I can't answer the phone, leave a message and I will return get back to you. And we do now have reserved parking for our WIC clients. So we've got like 10 or more places to park. So we're good. We're good. So thank you very kindly.
Thank you so much, Barrett. That was wonderful, very informative, lots of information. I wanted to pause though just to see if there were any other questions for Barrett before we wrap up her presentation. Feel free to unmute yourself or drop it in the chat if you do. And just a reminder that this presentation you will receive in the email follow-up that goes out after this meeting. So please look out for that. It's just really, it's great to see so many resources to support breastfeeding moms. I was someone who struggled early on in my breastfeeding journey, but was able to get through it with support, with help, and was able to successfully breastfeed for 2.5 years, my little one. And it's always a fun part of the journey when your child can tell you when they're ready to nurse and tell you when they're done because they have language. But yeah, I was really grateful to be able to do that. And Kathy, I see your hand up. Got a question?
Yeah, I do, Barrett. And it's another grandparent question because I work with a grandparent program. But if a grandparent was interested in getting more information or signing up for WIC, what do they need to have on hand to do that?
Well, they need to have basically custody of the baby. Okay.
Okay, so they do need to be the guardian.
They need to kind of be the guardian, yeah.
Okay.
Okay.
Yeah.
And what they would need to have is verification of address, verification of income. Okay, and the address is very, very, very simple. People think it's no. Just mail yourself something in the mail.
Okay.
Okay. Or even a piece of junk mail that has current resident and your name on it. That's verification of your address.
Okay.
Don't throw it out. Don't throw it out. Their income information. And just set up an appointment and we'll come in. They can come in. We can weigh and measure the baby. Of course, we will do a check to make sure the baby's not on the program at another location. You cannot have dual participation.
Okay.
And we can get them on the program.
Okay, great. Thank you.
You're welcome. You're welcome.
Thank you, Kathy. Okay, and it says, but if, I have another question in the chat already.
Sure.
It says, but if breastfeeding impacts the level of assistance they get, then how do non-breastfeeding guardians get as much assistance as they need?
Okay, non-breastfeeding guardians, if they're not a postpartum woman, they cannot get on the program. It's only for infants and women that are postpartum, and children up to the age of 5. So we do not give food benefits to dads. A lot of dads saying, I don't get benefit. No, you don't meet the category of having a newborn, being postpartum woman. You don't meet that category.
Okay, and then Luce, do you want to unmute yourself? I saw your hand raise.
Yeah, I saw you spoke about who qualifies for the WIC when they're pregnant and when someone loses their baby, for how many months or how long do they receive that?
6 months. 6
6
months post delivery. They're eligible for 6 months post delivery.
6. Thank you.
You're welcome.
Thank you.
We did have an issue with state WIC. We had a mom come in who was breastfeeding and her partner was also breastfeeding. And we had to ask state WIC, what do we do with this? Because we can't issue 2 breastfeeding benefits to one infant. And state came back and said, no, there's only 1 breastfeeding benefit per family, not 2. We didn't know what to do on that one, so we had to call state on that one, because technically there's 2 women that are breastfeeding 1 baby, and this is good, but how do we do this? So we had to one of the women became pregnant, so then they ended up having 2 families. So.
Okay. Any other questions? All right.
WIC is in all 50 states. Okay, and it's even abroad. If somebody is in the service in Italy, they can get WIC through the Department of Defense. And a lot of military families do not know that. It's all on the military bases as well, outside of the United States.
Great. Thank you so much. And I have to apologize. I just realized I got a message from someone asking for closed captioned. And I just saw it, so I'll be mindful of that for future meetings for anyone that needs those captions on. I think there might be a way for you to turn them on yourself if you need them. But I'll keep that in mind for future. Okay. Barrett, thank you so much again.
Thank you.
This was
And
wonderful.
I really appreciate your organization. Your organization is just absolutely wonderful. As I said, I've been on it. I've been with the program and I've seen your organization grow and thrive, and I'm so thrilled for y'all.
Wonderful. Thank you so much. Okay, so we are gonna wrap up with a few announcements. I'm gonna share a couple things, and then I'm gonna invite you to share any events, any newly launched or expanded programs or services, or any other resources that you want to spotlight. But first, I'm hoping that we have someone from Read to Me Stockton that is on, because I would love to have that news shared. If not, I'll go ahead and share. Okay, so I'll just
Both Ann and Mary are on.
oh, okay. Does
Yeah.
someone mind sharing if you can? I can't quite see.
So Mary, why don't you go ahead and share, because you're the kingpin in all this, the king queen in all this.
So we are thrilled to announce that the Imagination Library is now open to every single child under 5 in San Joaquin County. About 2 weeks ago, we added all of the remaining South County and East County zip codes. So now every single child in San Joaquin County, from the day they're born until the month they turn 5, is eligible to receive books from Dolly Parton's Imagination Library. Yay! And actually, the Valley's doing really well. Sacramento County now has a program for every child in their county. Stanislaus County, every child in their county. So our 3 counties are kind of leading the way. Just a reminder, families sign up and they get 1 book a month from the day they sign. Well, it takes about 2 months, 1 a month. If the family has 3 kids under 5, they can all be signed up. Families have the choice of books in English or bilingual English and Spanish books, the exact same books. And one other hint to share with families is if they have several children receiving books, the books may not all arrive on the same day. I get lots of phone calls from parents who said, I got 1 book, but I didn't get a second book. And they are shipped on different days. The Imagination Library is now shipping 3.2 million books per month, which is hard to believe. Oh. And just in our county, or in our program, we in September will mail 11,450. And we expect that number to jump as the word spreads that we now are covering the South County. And one other piece of news, Got Kids was the nonprofit serving Lodi in the North area. That program is now being run by the Lodi Public Library Foundation. Families shouldn't see any change in the books they receive, but it just is another nonprofit running that. And we're working together so every child in San Joaquin County can get books. Yeah, so please help us spread the word.
Yeah, we're very excited to have this happening. Read to Me Stockton has been around for 14 years now and just confined to Stockton. But with this expansion, we're spreading the great word about Dolly Parton's Imagination Library. And we're counting on all of you with all your connections with children and families to spread the word about this amazing expansion so that every child under 5 can be part of Dolly Parton's Imagination Library. Our goal is really to lift up the literacy rates in San Joaquin County and improve 3rd grade reading scores and improve the economic, social, and every facet of our lives here in San Joaquin County by have a literate workforce, literate children who can read and write. And it all starts at birth. And so we're counting on all of you to help us get the word out. There will be people can sign up right now. The families can sign up. Everything is ready there in the system. We'll have a very public kickoff in September in the South County to bring this information to them. You all know about it, those who are in Stockton, but South County, we're going to have a big kickoff on September 23rd. And we'll give you more details next month about that. But we're so pleased to have this happening in our organization and our nonprofit, because as you know, we're all volunteers. We do everything, but we have the funding support of First Five, the funding support of the county, the city. As word gets out, we're hoping that we're going to be able to afford all these books that are going to be sent to all these children, because potentially it will double our enrollment. And obviously, we need everyone's help to make this happen. But thank you all for your ongoing support, for getting the word out and helping us bring the Imagination Library to all of our children. Thank you.
Thank you so much, Mary and Anne. And we are celebrating with you all, lots of celebrating in the chat. It's just such an exciting thing to happen for our county and our families that we're serving. So we've got lots of providers in our meeting today that serve South County. And so it's a great time to be spreading the news about this resource that's now available to them. And so following up to this meeting, you'll get, again, the email, but we'll also be sending out these QR codes. So you get those that make it really easy to access the site, but also send the link so that you can just click and go directly to the site where families can sign up. All right. Okay, just a couple more things. So we know National Night Out is coming.
Questions?
Oh, yes.
Danica? No. Yeah.
Is there a question?
Luce. Look like Luce, you have your hand up?
Yeah, I do have a question. One of my families that I go, I have visits with them, told me that they had, I believe, this program, but they moved already. How can they change their address?
They can contact me. They can go ahead and sign up again, and I'll do the conversion. Um, I get that all the time. I'll get a duplicate registration, and I'll just update the previous registration.
Oh, okay. So I just told them to apply again, right?
That's probably the easiest.
Okay. Thank you.
Right, thank you. Any other questions? Okay. All right, so National Night Out is coming up. It is this Tuesday. You know, this is our annual kind of community building campaign. It happens across the country, but lots of events happening here locally. And I know downtown there's a really big one that happens, but it's every first Tuesday in the month of August, and it's the goal is to really strengthen those community to police partnerships, and so a lot of really positive, police presence at these events, and so it's just a good thing to connect families to because it's not just about that connection to our local law enforcement, but usually at these events, there's lots of other resources that are made available to families. And so it's just a fun kind of neighborhood community building time. And those events are held during the evening. Okay, just a quick resource spotlight. We are working in partnership with, so First Five is a part of the Human Services Agency, but under that umbrella, we're working closely with CPS to get this survey opportunity out to the community. And so it closes in about a month. And so we really want to get the word out. There is an opportunity for community members to win a gift card, but they really are working to gather information from the community about what supports would be most helpful for parents and caregivers in San Joaquin County. So it only takes just a few minutes to complete. It's a really short survey. This flyer will go out after the meeting in English and Spanish. But if you could help just spread the word about that, would be fantastic. And then my last announcement, if someone is on from Health Plan or Public Health or Amelia Ann Adams Whole Life Center and wants to share about this, feel free. But otherwise, this baby shower class series is coming up. I think it's happening now, and it will continue through March 2026. I'll send out the flyer following up to this meeting. But it seems like just a great opportunity for individuals to connect and learn and get some peer-to-peer support. Uh, I hope I'm describing that well enough. Okay. All right. Oh, Sandy, bless you. Do you have more accurate information to share?
Oh, not on this one.
Oh, okay.
But I do have some information. Um, on August 28th at 11:30 a.m. to 1 o'clock p.m., we will be at the Health Plan of San Joaquin as we're in partnership with them for the perinatal service coordinator event. So what we do is quarterly, we hold roundtable meetings with the providers at multiple hospitals in the county, and we also include the OBGYNs, the labor and delivery physicians, the midwives, the RNs, and the PAs to talk about all of these issues concerning maternal health and infant mortality. So our next training title would be low dose aspirin for preeclampsia prevention, essential skills and resources for addressing perinatal hypertension. And we all know that this is a huge problem in our community. And I have been able to extend this meeting to home visitors now so that we can be able to, catch some of our clients' complaints and make the appropriate referrals. But when you come to this meeting, do expect that some of the lingual will be in medical terms because it is dealing with medical providers, but I am inviting you all to it. But you will have to register early to save your spot as it's growing significantly, and there will be an online option that's going to come out probably this week. So I'll send the information to Giovanna because I tried to share it, be able to pull up here, and me and Ursula don't see a spot to do it. So I'll just send it to you.
Oh, I think I would need to stop sharing to give, but if you send it to
Okay,
me, yeah, I can make sure that it gets out.
okay.
Yeah, sorry about that. I think I would just need to stop sharing to allow you to do
Oh,
that.
you want me to try to
Sure,
do it?
I'll stop sharing if you like to share real quick.
Okay. Where is the option on the bottom
So you should
to
see a
send it?
share button.
Okay, share. Okay. Oh, okay. I think here it is.
If it's not cooperating, oh, there we go.
Can you see it?
It's starting to come up. Yep,
Oh, okay.
we see it.
Oh, I can't.
We see the flyer.
Okay,
Yeah.
so this is the flyer here. And like I said, the date is August the 28th. And I guess you can click on this QR code. Will that work?
I think it's for scanning, like
Oh,
with
for
your camera,
scanning.
yeah, camera phone,
Oh, okay,
uh,
okay.
maybe. But if
But
you
if you could
send
send
it,
this out.
yes, please email it to me and I'll make sure it goes out in the follow-up.
Oh, okay. All
Okay?
right. Okay,
All
thank you,
right.
everybody.
Thank you.
You're welcome.
You can go ahead and stop sharing.
Okay.
Yeah. Or I think I can just, yeah, there we go. Okay. Any other
Okay.
updates? Anything going on in your neck of the woods, your agencies, your fields that you like to
Ivana,
pay attention to? Yes. Hi,
good
Liz.
morning.
Morning.
Hi, good morning, everyone. Happy Friday.
Yeah.
I just wanted to share, if you can also share with your families, that Stockton Unified has officially started our 2025-26 school year. We started yesterday. Our first day of school was yesterday. And so just letting everyone out there know that Stockton Unified started July 31st. Thank you.
Wonderful. I'm seeing all the back to school pictures on social media, the kids on their first day. Super cute. Okay. Anything else going on? Okay, I see Alicia. Okay. Hi, this question is in regards to Read to Me. Read to Me, Stockton. We have a question for you here. It says, can you please share the web page for Stanislaus County? If I'm not mistaken, this county is also running the program.
Right, so the link takes you to the main Imagination Library website. You put in the zip code anywhere in the US or the other 4 countries, and it will take you to the page to sign up for that program. So there isn't a separate registration page for Stanislaus. Does that make sense? Yes?
Yeah. And Alicia, I'll send out the link that she's referring to in it might even be like imaginationlibrary.com or org, but we'll make sure it goes out in the email follow-up.
Imaginationlibrary.com/check-availability. I mean, or if you just go to imaginationlibrary.com and then you hit check availability.
Yeah, it's
And
really
then you hit
easy.
United States and then your zip code.
Yes. Thank you, Mary. Okay. Anything else? Okay. She confirmed. Yes. All right. Anything else before we wrap up? Going once, going twice. All right. Well, thank you all so much for being with us for another Community Link session. We will meet again next month. And just a couple really quick reminders. If you have any ideas, any topics, or if you would like to present on behalf of your agency or program or campaign that is launching, please reach out to me. I'm always on the hunt for, what's next, what we're going to be talking about next in the space. If you have a new team member that has joined and you would like them added to the distribution list, please email their email address and name to me directly, and I'm happy to add them. If you join this meeting because someone forwarded you this invite, but you did not receive it directly, then you're probably not on my list. So please email me your information, and so I can add you to the list so that you get the follow-up to this meeting and then future invites, and then save the date for our next meeting on September 5th. You all have a wonderful weekend and a great month, and we'll see you soon. Bye.
Hi, Giovanna.
Bye-bye, everyone.